As a therapist, can you explain some of the criteria that you use to say that it's safe for an athlete to return to play?
Sure. Some of the criteria, too, we're just doing some work on this as well, looking at perhaps we can make them more valid or reliable. Because if you think about even some of the criteria we use currently, like a single hop test, well, if you tear your dominant side, and we're comparing it to the non-dominant side, is that really a fair test when we're looking at distance covered on a hop? We may not be measuring or using a very valid tool. So I look at single leg squatting, so I'll look for the position of the knee. Can they maintain their knee outside of dynamic valgus? So we're not seeing that knock-knee position, no caving in of the knees. We look at jumping with gravity eliminated. So I'm a big proponent of using Pilates and the Pilates reformer, so we can have them do jumps, and I can look at their landing and their kinematics and the way that they land to watch for anything that may look a bit speculative to me. And that's something we can work on in stages, so we can take gravity out of the equation, and once they can do that really successfully, then we add gravity and we bring them in an upright position and integrate that. So very simple tools you can do in a very small amount of space. If you have the luxury of having a biomechanics lab available to you, that's wonderful, but that's not always very feasible, especially in some smaller rural communities. So we want to come up with 5 or 6 simple tests that you can do in a small office, and that will give you some certainty that this player is ready to return to play.
Yeah, I think that's very helpful because, as you said, most communities don't have access to high quality, high tech biomechanical labs.